Coordinating Director. I'm sorry, Amy. I serve as the Regional Coordinating Director for the Geographic Management of Cancer Health Disparities Programs. All of you work in research, so I know you love a good acronym like we do. So Gmap, and I'll let Amy introduce herself.
My name is Amy Doratha. I am the Regional Coordinating Director for Region 3. So you can see in our little logo up there which states are included. And I am housed at University of New Mexico in Albuquerque, New Mexico.
All right, so we'll go ahead and just jump right in there.
So a little bit about Gmap other than the acronym. It is made up of these 7 different regions that make from the United States and Puerto Rico. And each one has a hub from which the program is managed by the regional coordinating directors. Zakira and I are in those positions for our regions, and there are others in the other regions.
Yes, so a little bit about the objectives of Gmap. So as Amy mentioned, Gmap is a national program. It's funded by the National Cancer Institute. Under the National Cancer Institute is the Center to Reduce Cancer Health Disparities, or CRCHD. Can I get a thumbs up or a nod for folks that have heard about Gmap or have heard about CRCHD? Feel free to use your, okay, some people have. If not, great, this is why we're here. So we are a national program, as I mentioned, and we're designed to enhance the capacity of underrepresented minority cancer researchers in the following areas. So cancer and cancer health disparities research, and we do that through a number of different ways in our respective regions that Amy and I will get to. We also focus on recruiting and retaining the career and professional development of underrepresented minority investigators, trainees, and students. And we use the NIH's definition of underrepresented minority in biomedical sciences. So a lot of people tend to think that that is related to race and ethnicity, but that's not just race and ethnicity. It's also inclusive of other aspects such as first-generation Americans, sexual and gender minorities, those are economically disadvantaged. Those are just a couple of other examples of underrepresented minorities. We also work to communicate and disseminate information related to academic opportunities, as well as research and training opportunities, such as technical assistance, workshops, and webinars like this one to help spread the word about different opportunities in cancer and cancer health disparities research.
So another program we wanted to make you aware of is the CURE program. It's also with the Center to Reduce Cancer Health Disparities at the National Cancer Institute. It's called CURE. That stands for Continuing Umbrella of Research Experiences. And it's really a pipeline for researchers throughout their careers to stay connected with the resources of the NCI and CRCHD. And today we're going to hear from our experts, and they're going to talk about the diversity research supplements, which you'll see is the first item in each of these lists, which pertains to each stage in a researcher's career. So this is a great place for resources. So the regions are really, we do similar things, but we all have our things that we offer. And in Region 3, we do have trainings for grant writing, which would be like the webinar you'll see today. We also host reviews, so mock grant reviews. We have a monthly e-newsletter that goes out that has all those opportunities for you, jobs, trainings, workshops, and funding opportunities as well. We offer a couple different types of awards. We have the travel scholarships, which are designed to help researchers go and attend conferences, present abstracts, posters, and even sometimes attend a course to help in their research. We have pilot awards, which there's a call out once a year for those, and then their competitive application process, and the research completion awards as well. We also maintain a network that we use to connect people with mentors, mentees, so mentorship opportunities. We have communications on cancer and cancer health disparities research. For example, on our website, we have a featured scholar. So one of our scholars has done like a 30-second or 1-minute video to tell about their work and what they're working on. We also have that training community network that also connects with some of these other things. But if somebody needs mentoring or advice in one area, we do have a network we can draw from. And then of course, we encourage the attainment of those funding mechanisms of the National Cancer Institute, particularly the F, K, and R series, the research awards.
So before I get to what we offer in Region 2, Ali posed a great question in the chat. He asked, do you have to be a U.S. citizen for these programs? Great question, and that's something that we often field with our scholars. As you know, to receive a lot of federal dollars, you do have to be a U.S. citizen. So the short answer is that it depends. There are some programs, in particular, technical assistance workshop, that individuals that are not U.S. citizens can participate in. However, for the most part, to receive federal dollars, which the support that we give does come from federal dollars, you do have to be a U.S. citizen.
U.S. citizen or permanent resident.
Yeah. Or permanent resident, yes. Thank you, Dr. Meade. So I would say to reach out to the RCD or the contact at your institution. If you see a Gmap program or activity that you're interested in, reach out and ask, because it does somewhat depend on the program and activity. So how can Gmap Region 2 help you? What do we offer currently in Gmap Region 2? So Amy showed the slide. So Gmap Region 2 is composed of Florida, Georgia, Alabama, Mississippi, Louisiana, Missouri, Arkansas, and the territory of Puerto Rico. Right now, if you are a researcher, a student, a scholar in that region, you are considered a member. There is no formal membership process to join a Gmap region. As long as you are affiliated with an academic institution or a cancer center within the region, you are a part of that region. And so in Region 2 right now, we have monies available. And so I always encourage our scholars to reach out. Right now, I know conference season is starting to pick up. We have travel scholarships up to $2,000 to support your research or your abstract submission to support you presenting at a conference. Additionally, workshop attendance. So we have relaxed our rule. It used to be that you had to be presenting at the conference. Now, if you are attending to gain networking experience, you can also be supported by a travel award, and that is up to $2,000. Similarly, we have research or registration support scholarships. We know that a lot of activities have been transitioned to virtual. So if there is a virtual conference or workshop that you would like to attend, we can support you by paying the registration for that. Additionally, we have research reimbursement awards of up to $2,000. The caveat with that is that it is a reimbursement, so you will have to pay upfront and then be reimbursed. And included within the research reimbursement, the good thing about it is that it's really tailored to the researcher. So you fill out the application and let us know what you need in terms of your research. In the past, scholars have used those funds to pay for publication fees, lab equipment, and even like a biostatistician to pay for some of their data analysis. So those are just a few examples. We also offer expert grant reviews. So I heard someone, I forgot your name, I'm sorry, at the beginning that you are planning to submit a diversity supplement. So if you and your PI get your diversity supplement together and would like another set of eyes who have received this type of award to review your application to make it that much more competitive, we are open to doing that as well, paying the honorarium on your behalf to have that done. So
and just in specific, Zakara, in Region 2, if there's an idea that you have for those on the call, please get with Zakara rather quickly. We want to take these in over the next couple months, please.
Okay. Those are just a few examples. As you can see, we offer mentoring, connections, navigation to your PD or your PO, your program officer at the National Cancer Institute. It can be sometimes intimidating to reach out to them, but we provide that bridge, that connection to them. We work closely with them and we are able to connect you to facilitate that mentorship. Okay. So in closing, thank you, Amy. In closing, keep in touch. We want to turn it over to our speakers, but we want you to stay in contact, especially for those folks that have not heard about Gmap or learned about Gmap before. You got this maybe from a different listserv. There is a Gmap region for whatever state that you are in within the United States. There is a Gmap region. Amy and I, if you are not in region 2 or region 3, we are happy to connect you to the RCD in that region to get looped into the Gmap programs and activities that they have existing. I did want to mention that, you know, each region offers different things. For example, Amy mentioned that their region offers pilot awards. We don't offer pilot awards at this time. However, we offer things like a registration support and the other opportunities that I mentioned. So each region is a little bit different, but we all, the crux of it is that we are committed to supporting you in your academic and professional endeavors. So that is our contact information. The slides will be available. I think Amy mentioned that in the chat for you guys later or after, as soon as we wrap up. And it also contains our contact information. All right, I do see one question. Great. What are the selection criteria to receive the funds? So it depends. That's the short answer, that it depends. It's very specific to the award that you're wanting to apply for, and they are competitive. So there is an application. So if you reach out to me or Amy, we're happy to send you the application for the opportunity or the resource that you're interested in and to provide more specific information. So we're gonna roll right into our speakers to give them time to share their experience. I'll briefly give you their bios. We have Dr. Byrd. She received her BS in biology and an MPH in epidemiology from the University of Florida. She completed her PhD in epidemiology at Emory University, where her dissertation research focused on the development and validation of novel inflammation biomarker panel-weighted dietary and lifestyle inflammation scores and their associations with colorectal neoplasms. In January 2019, she joined the National Cancer Institute's Division of Cancer Epidemiology and Genetics as a postdoctoral fellow. During her time there, she conducted methodologic and microbiota studies and investigated associations of microbiota with cancer risk and diet with the gut metabolome. I hope I said that correctly. In January 2021, she joined Moffitt Cancer Center as an assistant member in the Department of Cancer Epidemiology, where she continues to contribute to the reduction of cancer disparities using an integrative and interdisciplinary approach to study microbiome-mediated mechanisms for cancer risk among diverse populations. Dr. Cathy Meade is a senior member in the Department of Health Outcomes and Behavior at Moffitt. Her research and education interests center on finding engaging and innovative ways to impact health disparities, producing culturally and literacy relevant cancer communications, creating sustained community-based education and outreach initiatives for medically underserved populations, and developing cancer training programs that investigators to conduct studies in the area of patient understanding, identifying the mismatch between patients' reading levels and the reading levels of health information. So I'll turn it over to Drs. Meade and Byrd for a wonderful webinar today.
Okay, thank you so much, Zakira and Amy, and welcome everybody. This is really exciting, and we're delighted to share with you some of our experience relative to writing for and acquiring a research supplement to promote diversity in health-related research. And what we hope to do by the end of our time is for you to make a determination if this might be the right path for you, whether you are the potential candidate or perhaps you're the PI or mentor. So with that, our agenda today, which we've done our welcome and introductions, we're going to do some nuts and bolts about the supplement. We're going to talk about a couple new terms, which are called the parent and the supplement grant. Our parent grant is the CARES REACH grant, and our supplement that Dr. Byrd will be talking about is a FIT Biobank. And then we'll move to questions and answers. But simply put, we want to kind of give you a little bit of an overview of this process, but really have you think about your career, because it's really important when you think about applying for a diversity supplement of where your career path is going. And what's exceedingly important in a diversity supplement is for you to articulate and write that down on paper of what you're doing now, what your education has prepared you, how the supplement will enhance that, not only from a research perspective, but from a training perspective as well. And then what are some of the strategies? And Dr. Byrd obviously was very successful on the first try, so we're excited for her to share that. And then as was identified by Zakira and Amy, an abundance of resources with Gmap and NCI. You were just exposed a bit to the umbrella, as we call it, the continuing umbrella of CURE experiences. And they too have a plethora of resources and opportunities for trainees. So if you are a trainee yourself or you're mentoring trainees, just Google CURE at CRCHD and begin to look at the numerous opportunities. But simply put, when one looks at a diversity supplement, it has several benefits. It can support the academic and professional career. It's nice because it gives a budget that includes salary and fringe benefits, potentially tuition for students, some supplies and travel, of course, with justification. I think what's really important is that it gives that time to actually do the research and attend different trainings and conferences. So it gives you that allocated time. But importantly, opportunities just as today to network with peers, mentors, and NCI program officers, and hopefully begin your career to not only funding on a diversity supplement, but then future NCI and NIH funding. So who's eligible for this? Well, interestingly, it can go all the way from high school to current investigators. And we've had a couple diversity supplements, both at the undergraduate and graduate level as well. Dr. Byrd is an investigator. And then actually just a few months ago, we submitted a second diversity supplement on the R01 that I'll be talking about today, for an individual who is baccalaureate prepared and currently working on her MPH. So again, they're at various levels. As one would imagine, the budgets are going to vary accordingly. And again, I think as was suggested, individuals who are underrepresented, which is a fairly wide spectrum, and not just defined by race or ethnicity, but also underrepresented based upon the science, disability, or a disadvantaged background. Again, talking to the program director about your specific situation can help hone in and pinpoint if you would fit the bill for that. One of the items that is submitted with the diversity supplement is the eligibility for criteria, which is signed off by your Office of Sponsored Research. And as was mentioned, citizens or permanent residents. What's a little bit different about this versus some of the F awards, as they're called, is that the PI of the parent grant, that would be myself and then Dr. Guede, we're a multiple PI on this particular R01. We are the ones required to submit the application. But that doesn't mean that Dr. Byrd did not write her diversity supplement. The key aspects of the supplement really relate to the qualifications, and I'm going to really emphasize this in terms of motivation. What's the motivation for the diversity supplement? How is it relevant to your career? And specifically, it needs to relate and be relevant to the parent grant. So if your parent grant is on, you know, a non-cancer topic and yours is, then you can see where they're not going to match up. It's very specific to the point that when you write the application, you will say that your research project supports and fits in with, say, aim 2 of the parent grant or something like that. And so that is, I think, a point that the program director at NCI was very specific on. Also, the description of the role of the mentors and what are your benchmarks. As with any other project that you may have been involved with, benchmarks and timelines are always part of this.
We do have one question, Dr. Meade.
Oh,
Is
sure.
that okay?
Oh,
In the
please do.
chat?
Yes, I'm not seeing the questions. Thank you.
Yeah, no problem. Could middle or high school teachers training be included as well?
I mean, as for them to be, I'm not clear.
Would you like, I don't want to mispronounce your name. Would you like to come on and ask your question or provide some clarification? Okay, we'll move on and then I'll try and get some clarification.
Yeah, there actually are projects like the Youth Enjoy Science, which is geared to training of teachers and so forth. If the teacher was in a research role and in some way they're going to move into a cancer research role, that would be what would be important. Now, if your project relates to something that relates to school education, the person could be a mentor or something like that, but I'd be happy to entertain that question as we go along. This slide really just summarizes what I was suggesting, and I think Dr. Byrd will go into this more detail. The motivation, the career goals of the applicant, and the research plan relating to that parent grant, whereby a research project is actually proposed, and then a training program to support that research project and extend your learning. What reviewers want to see is that there are some gaps, and this particular diversity supplement is going to fill it, and it's going to lead to something. So those are important statements that will need to be threaded throughout the project. Dr. Gabrib and Dr. Lopez at CRCHD, specific to this institute, are really, really helpful resources to run ideas, qualifications, eligibility, and would encourage anyone to contact them with your idea and your planning. Supplements are accepted about 3 times a year. So what I'd like to do is turn it over to, in our case, the candidate, which is Armin Byrd, as was previously introduced. And she's going to give a little bit about her journey and how her idea came to be. And again, this particular project is attached to an R01 parent grant. Most supplements are attached to an R01. Other grant mechanisms that are equivalent to an R01 also could qualify. Grants such as R03s, the smaller grants do not qualify for that. Okay, so Armin, you want, I'll take that, okay.
All right. Okay, well, thank you so much for having me today. And I just wanted to start off with a little bit of background about my career trajectory and how I ended up where I am today. As Zakira mentioned, I did my bachelor's in biology at the University of Florida, and it was there that I focused on learning how to use culturally sensitive communication, and I learned about health disparities, and that really made me want to learn more about this topic. So I went on to go get my master's in public health and epidemiology, and for my master's practicum, I conducted a study in the National Health Interview Survey where I estimated racial and ethnic differences in healthy behaviors among a population of cancer survivors. And I found that there's a lot of work to be done in the United States among cancer survivors, particularly minority cancer survivors that may be at higher risk for poorer outcomes. So I went on to pursue my PhD in epidemiology at Emory University. It was there that I wanted to really improve my expertise in nutritional epidemiology. So I developed diet and lifestyle inflammation scores to characterize the aggregate contributions of whole foods and lifestyle exposures to systemic inflammation. And I found that the scores were strongly associated with higher risk for colorectal cancer and its precursor colorectal adenomas. So over the course of this time, there was emerging research coming out that was characterizing the gut microbiome, that was implicating the gut microbiome in cancer risk, and also that was identifying that the gut microbiome could be influenced by what we eat. So I really wanted to make that connection between diet and cancer using the gut microbiome. So I went on to the National Cancer Institute where I completed my postdoctoral fellowship, training with Dr. Rashmi Sinha and Emily Bogdman. And in January 2021, I arrived at Moffitt, where I developed a research program which focused on ultimately reducing cancer burden, particularly among disproportionately affected populations. And to do that, I studied diet and lifestyle and also the gut microbiome. So one of my overall career goals to be able to do this very necessary work is to characterize the gut microbiome in diverse racial and ethnic groups and geographic locations. And so to do this work, I identified a screening intervention that Dr. Meade will describe that would really facilitate being able to collect microbiome samples in these diverse populations.
So I'll talk about CARES Reach, and I'm going to let you advance the slides to kind of keep it rolling along. So the particular parent project, as we call it, is the CARES Reach, Colorectal Cancer Awareness, Research, Education, and Screening, Rule Expansion, Access, and Capacity. So this is an R01 that is led by myself and Dr. Clement Guede, also a senior member here at Moffitt Cancer Center. So to qualify also for diversity supplement, you have to have at least 2 years left on the parent grant. And we are just entering our 3rd year as of this past April. So we met the qualification with that. Our study is involving the collection of fecal matter for the FIT test for colorectal cancer screening. So you can begin to see how we're having a marriage here. Dr. Byrd is coming newly on board here at Moffitt. So we knew of her awareness and her coming to Moffitt, and we began to have some conversations. We submitted the application last March, and believe it or not, it was awarded in August last year. So very quickly. So congratulations, Dr. Byrd, on that. So this particular study really is the result based upon implementation science, a long line of studies related to CBPR, community-based participatory research. And as you can see with the word cloud, very much involved with a community academic model for advancing colorectal cancer screening based upon trust, inclusivity, and really achieving equity among a number of populations. So next slide, Dr. Byrd. So as a teacher, I can't go without a talk, having a little quiz here. What percentage of deaths could be prevented with CRC screening? So who wants to toss out their answer? A, B, C, or D? Rapid answer.
You can add it to the chat too. We have some coming in. D.
Okay.
D,
what do we?
D.
Okay, let's go to the next slide and see what it is. 60%.
Mm-hmm.
So obviously a lot of deaths can be prevented with one of the most preventable beatable, but also detectable cancers. Next slide. So and you can keep flipping through so you have all 4 put up. Dr. Gwede and I have a history of a long series of research studies in the area of colorectal cancer with for Blacks, with Latinos, and testing out a number of interventions. Based upon those studies, we have developed educational materials which are bilingual. Also, we introduced to our federally qualified health centers the FIT test, which is the fecal immunochemical test. And our most recent study is combining that with an organizational champion. Next slide. So as you continue to click through and you can see the different bars in all of these studies, most of the clinics, and these are FQHCs, have probably baseline screening rates of around 18 to 35%. And through our RCTs, we've been able to get almost all of them near 80%. So based upon that, we felt like we had a number of evidence-based interventions, which then were ready to be deployed and delivered in an implementation science-based study. Next slide. Which leads us to the CARES REACH study, which is the current parent grant. And this was to speed up the adoption of effective CRC screening in clinics. What makes us different from our prior projects is that we're really moving our work not only in the urban area, right around the Tampa Bay area, but into more of the rural areas in Central Florida as well, and really moving into some new federally qualified health center, also with an attention on repeat screening, because we found that sometimes with the initial screening, unless the FIT test is done on an annual basis, the screening rates will drop. Next couple clicks. So it's really based upon an organizational wide model. It's looking at multi-level, not only a patient intervention receiving the evidence-based intervention, the FIT and the material, but also taking a look at the EMR, how we could work with organizations to implement triggers and prompts into their system. And really, let's look at a real world design. So we are also working at an evaluation of the implementation process, hopefully to boost what we call the UDS rates, or the Uniform Data Standards, which are really important benchmarks for the federally qualified health centers. So it's a multi-level, multi-step, and you can see some of the deliverables and materials on the right. What's different about this is that we have an organizational, what we call a champion, a cancer control champion, which is based at the organizational level, who's really monitoring what's going on in terms of the screenings and the providers. And so as we implement this in 14 federally qualified health centers, we hope that by the end of our 5 years, we will really be able to deploy this much wider into other primary care settings. Next slide. Our aims, and I'll let you speak to this because the first aim I think is what fits in with yours, Armin.
Yes. So my aim is nested within the first aim of CARES REACH, which was to implement this organization-wide multi-level colorectal cancer screening intervention using as what Dr. Meade referred to as the evidence-based interventions and the cancer control champions.
Right. The second aim is that we're going to be exploring the practice setting, the rural versus the urban, and some of those population characteristics that may be impactful versus foreign-born status, language preference, education, health insurance, income, that may differentially impact CRC uptake screening rates. And then again, we'll be looking at a comprehensive evaluation of the process. What is working? And we are working with 2 very large federally qualified health centers that each have their own champion. So we're tracking and documenting those processes so that we'll really have sort of this menu of items of successes or areas that can continually be improved. Next slide. So at the heart of what we do is the FIT test. Our prior studies were often focused on the use of the hemocult. Some of you may remember the little cards that had 3 little drops that you would put of the stool. Well, this is kind of clever, is that you collect the stool and you put it in this kit and just screw the cap on, and it gets sent back to pathology. It tests for blood in the stool to screen for colorectal cancer. Now it's provided to patients down to 45 versus the old age group of 50 to 75. And I think what Dr. Byrd is most interested in is what is normally discarded after testing. Hence, again, how the marriage came about. Next slide.
Yes, yes. And I just want to note, that a lot of my postdoctoral work, it actually focused on characterizing the microbiome in these colorectal cancer screening tests, such as the hemocult cards that Dr. Meade mentioned, and also the FIT test. And we found that the microbiome can be stably and accurately characterized using this test. And since they're just normally thrown out after they're tested for blood, I thought, why not keep them and develop a biobank of these samples? So leveraging the study that Dr. Meade and Dr. Guede had developed to implement these colorectal cancer screening interventions, I really thought it would be a great opportunity to address a limitation in the microbiome field, which is that most of the studies that we have so far are cross-sectional. So that means that the microbiome is measured and cancer is measured at one point in time. So we don't really know whether the cancer came first or the microbiome, or which is influencing which. Let's see. But what we ideally would like to have is samples collected prospectively over multiple time points across many years. So what the study that I'm developing or working on now for this diversity supplement is trying to do is create a prospective study with multiple fecal samples collected over time as characterized using the FIT test. So the goal overall is ultimately to establish a large biobank of these discarded FIT tests from diverse participants in the clinical screening population and in Florida. And this, you can kind of think of the diversity supplement as really getting you a jump start on what your ultimate long-term goals are. So eventually I would like to expand this biobank nationally. So the aims for the diversity supplement that I submitted are to implement baseline and repeat collection and storage of these residual FIT samples in community clinics in the Tampa Bay area, leveraging the CARES Reach study infrastructure. So as you'll kind of note when I talk a little bit about the research plan, I'm constantly connecting my aims back to the parent grant and, talking about how they connect with each other. And then I have a more, scientific aim, which is to validate the use of these FIT samples for investigating the associations of the microbiome with colorectal adenomas, which are the precursor to colorectal cancer. So I'll just go through what the research plan kind of includes and then give you some examples from what I included in my supplement. So first you want to include a summary or abstract and the specific aims of the funded parent grant or project. So in my diversity supplement application, the very first paragraph described the parent project, so the RO1. So I included all of the aims for that project, and then I connected it with my own research plans that are nested within those parent project aims.
So that really is the easiest page you have to put in is the parent grant because it's already done.
Yes, yes, you can just kind of copy and paste and modify as needed. Yes, and then you want to go into your own research project that are nested within those aims. So again, you want to highlight how your project is relevant to the parent grant. And then you want to go into your research design and aims. So even though for the diversity supplement, you don't really have like a standard specific aims page that you would see in an R01, I still listed out what were the specific aims for my project and gave a brief overview of how I would achieve that. And then I went into the methods and techniques that I would use to achieve the specific aims. And then I consistently throughout the application try to connect how these experiences would really enhance my overall research potential. So just to kind of give you an example of the types of things that I included in the research plan, I included a lot of detail on the sample and data collection. For example, how we're collecting the fit test and the types of questionnaires that we're collecting from patients. I included the process that the fit test would go to prior to arriving to Moffitt for freezer storage. I also included other important things that are, this is very applicable to human studies. If you're more basic science, it might be a little bit different. But for human research, you also want to make sure you include things like eligibility criteria, human subjects related matters like how you will provide informed consent, what types of data that you'll be collecting. And this just kind of is just a flow chart summarizing my aim 2. So in aim 2, I also went through kind of a detailed description of how I would find people who tested positive or negative on the fit test, and then people who test positive undergo a colonoscopy to diagnose, what is going on. And then I would implement what's called a case control study in epidemiology. To assess the associations of the microbiome with colorectal adenoma. And I also want to emphasize that you should also work with a biostatistician or someone who is very familiar with analyses pertinent to your project, and you want to include a good data analysis plan to show that you are capable of completing the project and that you have the necessary expertise to do so. I included a power calculation as well to show that the sample size that I proposed would be sufficient to achieve my scientific goals. So the next critical part of the diversity supplement application is the mentoring and career development plan. This will include a candidate-specific career development plan that is consistent with the goals that you lay out in your personal statement. So you may even want to start with your personal statement and outline what are your short-term goals, what are your long-term goals, and what are the skills that you need to fill in to be able to achieve those short and long-term goals. You want to include a description of the specific skills that you hope to gain during the experience. And what benchmarks, Dr. Meade emphasized benchmarks, what benchmarks are you hoping to reach during the diversity supplement period? This will probably depend on your career level. It may be an abstract or publication submission. For me personally, since I'm an investigator, it's an R01 submission towards the second year of the diversity supplement period. And you really want to make sure that you outline a very detailed plan that will help the reviewers understand how you will achieve these goals. So I've included here a direct copy of the table that I included in my mentoring and career development plan. So I'll note a few components here. So here, see if this pointer will work. Oh, I don't think it will, but in the gray bars, you see the, oops, go back. In the gray bars, you see my core training area. So I had 2 core training areas that I wanted to focus on during the diversity supplement period. The first was that I wanted to learn how to conduct very large population-based etiologic microbiome studies. For the second training area, I really wanted to learn how I could address racial and ethnic cancer disparities and truly engage and bring the benefit back to the community. So in this table, I listed out all of the activities that I would undertake to help me to achieve my training goals. In addition, you want to be thinking about how the experiences from your research project will also help you to achieve these training goals, and also how your mentors will directly be able to, give you guidance to achieve these goals that you've set as well. And you really want to include a timeline. So here's just an example of the table that I included in my application. As you'll see on the next slide, one of the main tips I have is to make sure that everything that you're doing is feasible. So you want to show your reviewers how you will progress through achieving the aims and goals of your diversity supplement. You want to make sure that you select a great mentoring team. It might include the PIs of the parent grant, and that would probably be recommended. And depending on your field, you probably would want to include a biostatistician, unless you can show that you have expertise in that yourself. But I did include a biostatistician in my proposal, and any other mentors that you include should really align with your career goals. You want to pick those who are experts in the different areas that you want to improve. So some other strategies and tips, there's many different components of this application. So you want to make sure that you start early and that you make a plan. I would recommend identifying mentors early and letting them know what you'll need from them. Like, you'll need at minimum their bio sketch and some of their help with putting together your application. Depending on your research project, you may need letters of support. And there's numerous other documents that are needed to be submitted. So it's a great idea to start early. That way you aren't rushing at the last minute. You want to ensure that the aims and plans that you make for both your research and training are feasible. It's depending on your career level, you may you want to discuss with your institution the possibility of support. Since the budget was kind of small for me to be able to collect the samples that I needed and have all of the laboratory needs met, I discussed with my institution the possibility of helping me out with some additional funds to supplement what was provided by the diversity supplement. So again, you want to do that early on. And you want to work really closely with your mentors, go back and forth with them with various drafts of the application, have them read and over everything that you're writing. I like to work from examples. I think that is very helpful. So if you can obtain examples in your field, that would be great. And you also, of course, want to obtain a copy of the parent R01 to help you put together your application. With any grant or proposal that you're submitting, of course, you want to read the guidelines really thoroughly, make sure that you have everything covered, because of course you wouldn't want to be disqualified because the guidelines or one of the guidelines wasn't met. And if you have questions, regularly communicate with the program officer to make sure you have everything covered and all of your questions answered.
I think we're ready for questions. I have several questions to ask Dr. Byrd, but perhaps we have some questions from our audience here.
I also have one that came in that I can ask that you guys can maybe address. So, is there any wiggle room with the 2 years left on the parent grant? So, for example, what if there's 1.5 years left? Have you guys, from your experience, seen any wiggle room with that? And
I
why
have
the
not.
2 years?
I have not.
I figure.
And you can always check it out with the PD, but I have not. Because part of it is that by the time you submit it and it gets reviewed, another 6 months may have elapsed. So it's tricky. Yeah.
Okay, we do have another question. Is a supplement usually for 1 year's funding, or could it be multi-years, multiple years?
It could be multiple years.
Mhm.
Okay. All righty.
Other questions? How many are ready to write a diversity supplement? I want to see hands here. I'm gonna stop.
Did you want to ask your questions, Dr. Meade, or we
Sure.
also have a couple
Dr. Byrd,
prepared?
how long would you say once you had the idea that it took you to write this supplement?
Well, for me, it was, I guess, a special situation. So I think I decided a little bit last minute, which you should not do. So I was rushing a little bit, but I think it took me about 6 weeks
Okay.
until I submitted, I believe. Mhm.
Okay. And what can you tell us about your other mentors besides the PIs of the parent grant? Who are your other mentors and how do they supplement what your program of research is?
Sure. So the other mentors were Dr. Kathleen Egan. She's my primary mentor here in my department at Moffitt. And she has been conducting these population-based molecular epidemiology studies throughout her career. So she fit really well with me developing this large population-based biobank of diverse individuals. So she's able to give me a lot of insight on, the collection methods, what types of data, I need to be focusing on, any types of methodological issues related to epidemiology. And I also had a biostatistician, Dr. Zhufeng Wang, as a mentor as well. So, for the microbiome, especially, there's a lot of fancy statistical techniques, some of which I'm familiar with, some of which I'm not. So he was able to kind of go through my analysis plan and confirm, everything that I was doing sounded appropriate.
We have a great question in the chat from Amy. I'll read it. Any creative examples of identifying eligible trainees who are interested? Seems like most PIs with an R01 would welcome the opportunity, but it's harder to find the right trainee. I'll let Dr. Meade hop in, but let me just say that that is a part of our role as the regional coordinating director for Gmap. So if you are if you are a PI of an R01 and you would like to connect with a trainee in your same field, we are happy to facilitate some of those connections. A lot of scholars pass through our emails, through our doors that we connect with that are also looking for these opportunities. So working your network, and the RCDs are happy to help try and facilitate some of those connections. I'm sure Dr. Meade has some insight as well.
So creative ideas to identify eligible trainees. One could certainly look, if you're based at an academic institution, some of your colleges, your biochemistry, the College of Public Health, you can look at those areas. You might have summer students that are passing through that may qualify for that. You may have a postdoctoral trainee who perhaps is finished and now you're looking to do a supplement. That was actually one of our situation. One of our postdocs had completed and he wanted some additional training and we could attach him to one of our large grants. So we wrote a supplement. So those might be some creative ways, but other people have any other ideas? That sometimes the reverse is often difficult, where the trainee has not been able to identify a mentor. So, you know, it's kind of like this matching game of identifying people at the institution who have the similar interests. Zakira, maybe you could speak to the NIH reporter, how that could be a helpful tool for some individuals.
Yes, so we use NIH Reporter to identify PIs that have RO1s with with at least 2 years left. So we keep, I guess, a repository of sorts. The NCI requests that information from us. So we often sometimes do reach out to PIs that have at least 2 years to see if they are interested in a diversity supplement, and then help facilitate that connection with an eligible trainee.
Mm-hmm.
Yes. I see a hand raised. Feel free to unmute.
Yes.
Please pronounce your name. I don't want to mispronounce it.
This is Xixia Huang from Baylor
Okay.
College of Medicine. So this is a great presentation, a lot of great information. So I have a couple of questions. The main is identify the parent grant. And also the 3 times, I think Cathy mentioned that you could submit 3 supplements per year. I might have misunderstood.
Oh, there's 3 opportunities throughout the year that you can submit. Now, I will say that if you have a parent grant, typically an RO1 would be a qualifying one. An RO1 grant can have up to 2 diversity supplements at one time. Okay. Some of the other mechanisms may only allow 1 supplement. So again, you have to look at the eligibility for that as well.
Oh, okay. So the teachers training I mentioned earlier. So at our college, we do, and we have high school students training, college students training. Also this year, I'm starting a high school and middle school teachers training. So that's why I asked that question earlier. So I was wondering earlier, I think, and the first presentation also showed a lot of resources for attending conferences and the students. There's a lot of information here. I just feel that there's so many things over here trying to identify what is suitable for us, for me.
Yes. We'll share the slides. One thing is to please reach out to us. We have you. We can connect you with the RCD, or is Baylor in your region, Amy? Either way, we can connect you with the RCD to let you know what resources are currently available. So feel free to reach out. Yeah.
Thank you so much.
And I really would encourage you to go to the Center to Reduce Cancer Health Disparities website and the CURE website and just become familiar with that. And Zakira or Amy can connect you with your RCD within your region if you're not in one of our 2 regions, and walk you through this. And I saw a question come through before, which we may not have time to address, relative to K awards. And the main difference with the K award is that that is awarded to an individual as opposed to the PI of the parent grant. So again, there's a number of training opportunities for individuals. So if someone has an interesting, engaging, and an impactful idea, I think that there's probably an opportunity to match it up for an application.
Fantastic. Thank you.
And Amy.
Okay. Well, this has been a wonderful session. A big thank you once again to Dr. Meade and Dr. Byrd. Thank you so much for sharing your knowledge and expertise with the group. And I just wanted to put in one last plug. Please do reach out to the Regional Coordinating Director of your Gmap program. And I was going to put the slide up with our contacts again. And also, I dropped in the chat a link. If you would, please fill out a very brief evaluation of this webinar. We'd love to hear how your experience was. And feel free to follow up with myself or Dr. Byrd and the 2 coordinators, and we'd be happy to have a sidebar conversation with you.
Absolutely. If you have any questions that we did not get to, we are happy to field those after. And
absolutely.
Amy has shared our contact.
There's our contacts at the bottom, email, and you can find us on social media.
And don't forget the eval, 3 minutes. I promise you it will take 3 minutes.
It's quick. It's very quick, very painless.
All right.
Thanks everybody.
Thank you everyone for joining us. Have a wonderful rest of your work week. Bye.
you.
Thank you.
Hi, Iris. If you're still on, feel free to shoot me an email and we will connect you. I'm not sure if you're here, either me or Amy, if you got our contact information.
Also, for
Thank
those
you.
people that, yes.
I
For
just
those
want to
people
say
that
thank you
did-
so much.
Oh.
Absolutely.
You're
I'll
welcome.
definitely contact you because I do have quite some questions for like to identify resources for us to apply.
Yes, and you said you're at Baylor?
Yeah, Baylor College of Medicine.
Yes, that is in our Region 3. So
Oh,
definitely
wonderful.
feel free to send me an email with specific questions and
Okay,
I'll get
I'll
you
do
hooked
that.
up.
Thank you
If
so much.
everyone who registered, I'm going to try to send an email if I have your email address with the link for the evaluation as well. So
Yes,
if you can't do it
thanks.
at this moment, you'll have another opportunity.
Okay, thanks. I already sent my feedback, but it's very short. It's excellent for everything.
Perfect. Yes,
Thank
thank you.
Okay,
Okay,
see you.
bye.
Bye.
Amy, you want us to stay on real quick?
Yep, I'll hang on. And I saved the chat, so I got it.
Okay. Okay. Or we can hang up and call back. Yeah, I always forget to save the chat, and after I'm always like, I meant to save the chat because once you end the meeting for everyone,